3:37. Managing communication challenges in dementia patients. Imagine trying to communicate with your loved one that they need to take their medication or use the restroom, and the response you get is anger, indifference, or they just walk away from you. Caring for people with dementia poses many challenges for both families and caregivers. People with dementia find it more and more difficult to remember things, think clearly, communicate with others, or even care for themselves. In this presentation, I will talk about the growing number of people with dementia, the challenges of working with a dementia patient, and methods of communicating with them. First, I will discuss the reasons it is important we all learn about communicating with someone with dementia. In the September issue of Nursing Standard, it stated the number of people aged over 85 is predicted to rise by 27% over the next 10 years. Dementia affects 1 person in 20 over age 65 and 1 in 5 over 80 years old. It is estimated that 24 million people worldwide have dementia, and more people are now choosing to care for their loved ones at home. It is therefore becoming increasingly likely that you will come in contact with someone who has dementia in the future, and being informed will give you a better chance at success when you're trying to communicate with them. With the number of people who have dementia on the rise, it is important to understand why they struggle to communicate. I will discuss some of these reasons here. Dementia patients have a shortened attention span. This makes it harder to communicate messages to them. They often have hearing or vision deficits, and this adds an additional challenge to communicating with them. They also can have difficulty with speech due to health issues such as stroke. In the dementia patient, fact and fantasy can sometimes become intertwined. These things all make it harder for the dementia patient to understand what we are trying to tell them. It also makes it hard for them to communicate their wants and needs to us. When they become confused, it may lead to frustration and combative behaviors. Now that we have learned a little about dementia and the challenges it poses, I will discuss some ways to increase success when communicating with the dementia patient. People with dementia have a limited attention span. Therefore, it is important not to use long, multi-step instructions when asking them to do a task. Keep the background noise to a minimum, and as this can provide a distraction. Break down requests into short and simple tasks and use words familiar to the person. Repeat or rephrase questions as needed and allow ample time, as it takes longer for them to process information. Make eye contact, call them by name, and speak slowly and clearly. Remember, people with dementia respond quickly to changes in body language. Get down to their level, avoid agitated movements and tense facial expressions. You may need to walk with the person, as some dementia patients can tend to wander and have a hard time sitting still. The person with dementia can tend to lose their train of thought and keep returning to the same conversation over and over again. It is essential not to lose your patience. When a person with dementia starts to get agitated, try redirecting the conversation to something less stressful for them, or something they are familiar or comfortable with. Perhaps offer a snack or a drink and come back to the subject later. Keeping a behavioral journal, recording the time of day or night the behavior occurred and what may have triggered it, and what works to diffuse the behavior. This will give you a reference point to use when dealing with difficult issues that may occur when trying to communicate with the subject. Most of all, remember to treat the person with the utmost courtesy and respect. Don't treat them like a child, talk to them like they are not there, or patronize them. It is important to preserve their dignity and sense of identity by including them in your conversation. We have learned that the inability to communicate can lead to frustration in the dementia patient, and there are methods that can make it easier and less stressful for them and you. In conclusion, communicating with a person with dementia can be a challenging yet rewarding experience, whether it's a loved one, acquaintance, or if you are the caregiver. With the proper training and techniques, you can face this challenge and be successful. Being patient, keeping a behavioral journal, and being mindful of your body language are just a few examples that I have given you that you can use to better communicate with the person who has dementia. As the number of people with dementia increases, I hope you will now be better prepared to deal with them in a caring, respectful manner. Thank you.
They're all still here.
6 minutes.